Hi, my name is Dr. Shelby Cooper. I'm a physician at the Bassett Medical Center, and we'll be serving as moderator today. We'll be discussing mental health issues in this COVID or coronavirus era. I have two Bassett mental health specialists with me today, Dr. Johns and Dr. Anderson. Dr. Johns is currently the chief of psychiatry at the Bassett Medical Center. She's been at Bassett for over 30 years. She attended medical school at New York University and did her psychiatry residency at the Mount Sinai Hospital in New York City. And Dr. Anderson is a clinical psychologist at Bassett. He is also the medical director for Leatherstocking Healthcare Collaborative. He's been at Bassett for 5 years, completing his psychology PhD at Western Michigan University and a postdoc fellowship at the University of Massachusetts Medical School. I'm going to direct the first question to Dr. Anderson, and I'd like you to really sort of frame the problem for us that we're going to be discussing today. What is it that's unique about mental health in this mental health issues in this coronavirus pandemic era?
Yeah, well, thanks, Dr. Cooper, and Dr. Johns as well. Thanks for joining me here today. Well, this is a unique time, I think, not just for our hospital and our region, but for our country and our world. This is an event of stress, I think, that is unprecedented, at least for the last century or so. And so we're in a moment right now where people are experiencing an increased degree of stress coming from multiple domains. We have people that are worried economically. People are worried about their jobs. We've got people that are in a period of social upheaval as they are either having hours cut, in some cases being asked to work additional hours, and simultaneously being asked to do their jobs in different ways, perhaps taking on new tasks. All the while, they are worrying about their children at home who are having their school routines disrupted. They might be worried about parents who are elderly and at increased risk of infection. Because this is a new disease, we are learning all the time about just how risky this can be. And because information is both incomplete and can be changing daily, if not more rapidly, all of those factors kind of come together to create an environment in which people are at increased susceptibility to subjectively experiencing a feeling of stress or anxiety, as there are so many things all happening at the same time.
Right. I know we're all affected by this in various ways. For those that really are struggling, I know that on this talk we're going to have some listed contact numbers and websites. But are there any specifically that you could describe right now as some resource for somebody who really is struggling with this, possibly having suicidal thoughts or some real other mental health issues?
I think that when people are feeling so stressed that they're worried about anything that is dangerous for themselves or for people around them, or where their function has changed to the point that it is a significant change, it is absolutely appropriate and even necessary to get help. And the ways to get it are very much the same as they always are, and yet I think the mental health community is very aware of the pressures on people right now and very receptive to people being in contact. So if all else fails, the local emergency room is always the right thing to choose. Short of that, the community resources, including the Bassett Hospital, Department of Psychiatry, and any county in our area, any county mental health clinic, and there is one for every single county, all have open phone lines, all have the ability to very quickly see somebody, get help, reach out. There's also lots of telephone availability. There's a mobile crisis line, and we'll make sure that that's posted later. And there's something called a warm line in lots of our communities that's a level down. You don't call them if you are feeling at your wit's end, can't go on anymore. But if you're feeling like I'm struggling and I just need to talk to somebody who's going to understand, there are warm lines. Again, we'll make sure that those phone numbers are posted of people that can say, yeah, we understand, and we can also help point you in the right direction.
Yeah.
Great.
Perfect. And I would just add, in addition to all of those really strong recommendations for Dr. Johns, this would be for somebody who is experiencing an increased level of depression or anxiety, but perhaps something short of acute suicidality. If you have an established relationship with your primary care clinician, they are well equipped to be able to help assess, treat, and if it is something that is beyond their scope, help get you situated to go in the right direction to get the level of care that you need. So that is not instead of, but that is in addition to the nice list of recommendations that Dr. Johns just offered.
Absolutely.
Yeah, that's a great addition. Dr. Johns, medications for patients or the general public that might be struggling. Are there any recommendations or thoughts on additional medications people might consider?
My recommendation is, in general, to avoid additional medications. We all know that there are things that are going to make us anxious and things that are going to make us sad and things that are going to make us scared. And it's generally best to reach out and use non-pharmacologic techniques, meaning supportive conversations, phone calls, breathing, meditation, yoga, all of the things that we talk about as being non-medication means to help us cope. There is really nothing essentially wrong with some feelings of discomfort and stress in what we're all going through, because we are all going through it. Now, having said that, if you are already on a medication, dosage adjustments might be needed in this time, and that's when you go back to your prescriber, whether it's your GP or your mental health or any other specialized treatment provider. And again, any of the other resources that we just mentioned before would be there if you're feeling like, yeah, no, this is absolutely something that I can't manage.
Great, thanks.
Could I just add something there?
Sure.
I think Dr. John said something that I think is really important. And that is acknowledging that when we are in the midst of a generational or multi-generational traumatic event, we have to be compassionate to ourselves and we have to be compassionate to others. And an expectation that you yourself or that your loved ones are going to be functioning as if everything is fine when it is very clearly not, is unrealistic and unfair.
Yeah.
And so if you find that you have some moments where you're not sleeping quite as well as you might usually, or if you find that you have a moment that maybe your daughter or your husband are a little bit shorter in their response to you than they typically are, breathe. Take a minute. Don't engage in every argument to which you are invited. It is okay to feel a little bit distressed when we're in the midst of this multi-generational traumatic event. And so there is this fine line. Absolutely. If you are going days at a time that you are debilitated by anxiety or depression to the point that you are unable to function in daily tasks at least a passable margin, then by all means reach out for some help. If you are feeling that you are just coming a bit short for short periods of time of your optimal functioning, please give yourself a break. This is a really, really hard time. We don't have a roadmap for this, and we're all kind of trying to figure this out as we go.
Yes.
Right.
Yes.
That's good advice.
Yes.
Short of medications, then coping mechanisms for other manifestations of the stress or anxiety of this, sleep problems, generalized anxiety, all these sorts of things. Do you have any advice for just general coping mechanisms for the public?
Sure. There's some standbys that can be useful right now. We know across the board, I sometimes will joke with patients, sort of a half joke, that one of the most powerful interventions that we have across not just mental health, but across medicine is exercise. And that remains true now. And so finding a way to move your body, finding a way to move in a way that gets your heart rate up a little bit, can help you clear your mind, can help to reduce stress. Consequently, if some of that stress is coming from tighter quarters than you are used to having, it can offer sort of a natural reprieve by giving folks a chance to kind of take a break and reset. So exercise is a big one, I think. In particular, exercise that has a little bit of a rhythmic quality to it can offer a bit of, I don't want to overstate this, but a bit of sort of a meditative quality as well. It is helpful in times of anxiety rather than to try to avoid thinking about a particular thing, to give yourself something that is simple and specific on which to focus. And so something like breathing, something like running and focusing on the rhythm of right, left, and additional to the sort of physiological benefit that can offer, gives sort of a nice thing for your brain or your mind to focus on to take you off of the things that are causing you to feel that increased stress.
Yes.
Great. The other issue that is something that occurs to me and others for sure during this, you see some joking about it on social media, but substance abuse, and I'm not talking about the truly destructive social abuse that, not social abuse, substance abuse that we might see regularly. I'm talking about maybe a little bit of uptick in substance abuse. People that are social drinkers and find themselves in this era, maybe drinking a little bit more or a little bit earlier. What are your thoughts on that? And is that something that folks should be concerned about or alter? What advice do you guys have on that?
I think that it is something that we should be very aware of. It's almost a cliche that in the last month, people have been turning to excessive use of many things. A lot of people food, a lot of some people alcohol or other drugs. We'll leave aside screen time because that's just another whole story. But it is a risk, and you need to be as self-aware as you can and keep an eye on yourself. If you're used to having a glass of wine every now and then, and it's become a glass of wine more evenings than not, I suspect that no one's going to say that that is a terrible thing. On the other hand, if you've started to use a substance, alcohol, tobacco, marijuana, when you had not been in the habit of it, ask yourself why, and ask yourself if that's a path you want to go down. If you're not sure, if you are thinking, I'm really okay with all this, yeah, I'm drinking more, but so what? Be alert to what your family and friends are saying. If your family, if your spouse, if your child notices that you're changing in any way, take that very seriously.
Yeah.
It is drugs are addictive for a reason. They turn on parts of our brain that really want to be turned on, especially when we're stressed or scared or depressed. And the part of your brain, the large part of your brain that can say, that's not what I want to do, may have to be activated. And there's ways to get help for that too. An addition to all of the things we've talked about, there's a wonderful resource called For Do, which is an organization of peers that can reach out and offer help. If you think that you're moving down a road of substance use that you had been on the past, or see yourself going down now, we're going to make sure that their contact information is also posted at the end of this.
Yeah. Wonderful advice, and if I can, I'll offer just some potential goalposts for folks if they are trying to do sort of a self-assessment, if they are wondering if their use of alcohol or perhaps other drugs has gotten to a level that should cause them concern. So if you're noticing in this period, it's been going on now, I think we're into our fifth week. Mm-hmm. If you're noticing that there has been over that period of time that maybe you had an increase in the amount of your substance that you were consuming, you tried to cut down, but you're not able to, that's something to pay attention to. If you're noticing over this period of time that your use of drugs has caused others who know you well, your friends, your family, to become agitated, that's a checkpoint. That's something to be aware of. If you have had times where you have felt guilty in some way about your amount of drinking, your amount of drug use, or the behavior that results from said drug use, that's something to be aware of. And then finally, if you have gotten to the point where first thing in the morning you are up and you are going to alcohol or another drug in order to get rid of a hangover or get rid of signs of withdrawal, things that we call sort of an eye-opener, that is absolutely a sign. And so none of those in and of themselves are going to be diagnostic of a substance use disorder, but any one of them, and certainly if you have more than one of those that you're kind of doing a self-assessment and saying yes, I'd say pause, pay attention, and maybe look a little bit more closely at some of the resources that Dr. Johns is mentioning to try to figure out whether help might be useful to you.
That is a fantastic and very user-friendly, if I may, way to kind of look at what you're doing and whether it's something that may need to be fixed. I like that a lot.
Absolutely. What if it's not you? What if it's others in your family that you see as struggling in a way that is becoming a problem, at least from your perspective, whether it's substance abuse or anxiety, depression, even potentially abusive behavior? Well, maybe all of them have a different approach. I don't know, but what recommendations do you have to involve one person and another person in getting some mental health advice or help?
Dr. Anderson, do you want to take a stab at this first?
Yeah, sure. This is always a challenging thing. and with mental health and addiction, this is an issue. I suspect that with other health conditions as well, whether we're dealing with obesity or food intake, it is a sensitive topic to bring this up for a loved one when they maybe aren't at the point of recognition themselves. And so I guess this, I hope that this doesn't sound overly cliche, but the first step is to be gentle and to go slow. And you want to express empathy for the person, and start by expressing some concern. I love you and I am worried about you. Make a statement and see how the person responds. Ideally, you want to get to a point that person gets to a place. I guess I'm sort of imagining adults here. Kids is a little bit of a different animal. But when you're talking about one adult to another, at the end of the day, if this person is going to engage in treatment, they're going to have to do a lot of the work. And so it's not enough to just confront them and point them out. In fact, confrontation can have sort of the opposite of intended effect. It can make the condition worse. It can sow argument between the two of you. So I guess I would say start with compassion, start with empathy, start with listening, and see if you can find a way to get that person to recognize or acknowledge the problems that you are seeing. And if you can get to that point, that the person is becoming aware of what it is that you are seeing, you're going to have a much better chance of getting that person engaged and stick with treatment. Alternatively, maybe you'll be happy because the person will talk you out of it. Maybe they will say, listen, I love you, and yes, I am feeling some stress right now, but guess what? We're in the middle of this generational trauma. I'm going to be okay. Can we sit down and just watch Gone with the Wind together? It is possible that if you engage in that conversation, you will be pleasantly surprised that things aren't as bad as you thought. And also, quite frankly, sometimes that human connection and just that show of concern between loved ones, sometimes that's enough. So, Dr. Jones, I don't know if there's anything you would add to that, but that's my initial response.
I totally agree with that. I think that in part of what you're saying is that getting help really goes best when it is the individual themselves that is able to say, I have goals and this is how I want to reach them, and my goal is to decrease my drinking or to get some help. So what you're suggesting is open communication, talk to people, and then see if you can point out why you're concerned, and if the person that you're concerned about might be able to partner with you in saying, okay, I can see your point, and maybe I would like to do this to change it. Shelby, at the very beginning, you mentioned suicidality, and that also goes for behaviors that are really, really worrisome. Someone that is becoming violent, somebody that is behaving in a way that could be dangerous. Those are the times when just talking and just getting cooperation may not be enough. And
Right.
that's when reaching out to your own doctor, to the emergency room, if you have to the police at 911. This situation, the COVID situation, no situation is ever an excuse for violence towards another person or towards yourself. And protection is the number one word at all times.
Right. So, short of extreme behaviors of that sort, respectful, compassionate dialogue, really a great starting point. Can really never go wrong with that.
Mm-hmm.
And my last question, pitfalls, things, behavior, obviously our lives are completely different for most people right now. The way you conduct your days is utterly different for most people, and it involves a lot more time at home and work from home. pitfalls to avoid, behavioral pitfalls, things that you might recommend for just general mental health overall?
Mhm. Dr. Anderson, you're the one that's been teaching us all about keeping a schedule and how to manage. So I'm definitely turning this one over to you.
Yeah, okay. Well, so again, I will answer this with a bit of a reframe. I really encourage folks, whether they are thinking behaviorally or whether they are thinking about sort of mental processes, to put things in the framework of what they are doing or what they are aspiring to do, as much as what they are avoiding doing. And so, if you are in the place that you are working from home, or maybe you are just at home, but furloughed from work, or not working at this moment,
All right.
being able to develop a routine, even if it looks a little bit different than your typical routine, can help with stability, both for yourself as well as for others around you. So if you are working from home, I know that it is tempting at times to stumble down and maybe do some work in sweatpants and underwear or what have you. But the extent to which you are able to dress for the task that you are trying to engage in, whether that be social or play with your kids or work, can be a helpful sort of signal to yourself as well as to those around you, to kind of get your brain and your body on track for doing that work. Similarly, I can speak both from professional knowledge as well as anecdotal experience as somebody who's doing some work from home right now. Setting up a schedule as it pertains to work and giving some clear cues that it is work time right now can be helpful in signaling to children in particular about what is supposed to happen right now. And so I'm not going to pretend that this is any kind of a magic bullet solution by any means, but if you're able to set up specific times, specific areas, specific dress that signals to your child that it is work time right now, it might help a little bit. It's not going to make it perfect, but it might help a little bit in being able to get a little bit more done in these challenging and unusual circumstances.
Yeah, that's great. Great advice. Thanks. Celeste, I'll leave the last comments to you. If you have any further thoughts, any suggestions to the public at large on mental health issues in this COVID era.
Yes, I think that what we've both been stressing is that feeling stressed is very, very normal. There's stresses on so many levels. Those of us that are working full time are stressed. We may be feeling pulled away from family. We may be feeling guilty about the infections that we could be bringing home, or just the protection that we're not able to give. There is an equal amount of stress if you are not able to work or if you're working from home. This is a tough time, and the uncertainty of the time heightens the stress. Don't kid yourself. Don't think that somehow you should be above it, or somehow you're immune, or somehow it's not affecting you. It is almost all anybody is talking about, no matter where we go. It's out there. Be kind to yourself, be respectful of others, stop and breathe.
Yeah. And the last thing that I will say, unless Dr. Cooper, you have some other questions, I say this certainly for myself, and I think on behalf of Bassett, I guess I want to thank our surrounding communities. I have been just incredibly proud of the response of the communities that we have the privilege to serve, in terms of respecting the requests to stay at home, in terms of coming up huge with constructing masks when we have shortage, in terms of being adaptive to us as we are forced to adopt different workflows in order to keep folks safe. And so I would imagine that most of the folks who are watching this are going to be folks within our region. And for myself, and I think behalf of Bassett, I just want to say thank you. You are doing an awesome job, and we are going to get through this.
Yes.
Absolutely. Well, those are excellent closing comments. Great, fantastic. Thanks for joining today, and to everybody out there, good luck and stay safe.
Thank you.
Bye now.